Now, let me welcome Dr. Rajan, and his topic today is Introduction to the Kerala Agent Survey 1 and 2. Dr. Rajan, please.
Thank you. Thank you very much for inviting me to be part of this very interesting aging survey issues throughout Asia and globally. In fact, I would like to start thanking the organizer for inviting me. And I am going to spend my time, probably the 15 minutes, to give you a brief understanding of what we have done so far in Kerala. Of course, I live in India, but this particular survey is done in Kerala, where I live right now. But it is not that we have done this survey in Kerala because I am living there. Kerala is one of the states in this country, in India, which has the lowest fertility of replacement level almost 30 years back. So Kerala is the state in this country with very low fertility and very high life expectancy. And an average elderly in Kerala lives 20 plus years after attaining 60 years. This is what attracted us for us to look at Kerala in a more serious way in the context of aging. And Kerala, if you look at it, fertility and mortality is almost constant now. Not much interest on fertility in Kerala to do research. Not much interest on fertility because fertility is, I said earlier, replacement level fertility is almost there. And mortality is also very low.
I'm sorry, Dr. Rajan, did you share your screen?
No, I am not sharing screen. I'm only speaking.
Okay, thank you. Thank you.
So Kerala, we have already having what is called the replacement level fertility. And people, I said that infant mortality rate is close to 10. So Kerala is the fertile place for doing research on aging. In addition to that, Kerala also play a major role in both internal and international migration. Today, in Kerala, when I speak, almost 10% of the labor force from Kerala is living anywhere in the world who are supposed to be in Kerala. And they send us remittances close to 30% of the Kerala state income. Can you imagine how much Kerala is dependent on the remittance economy? That led us to start both migration surveys and aging surveys in Kerala. In fact, our migration survey, which is also an important component of our aging survey, which I'll speak in a minute, we started working on the migration survey since 1998. Our first migration survey was done in 1998, and we complete the survey every 5 years. We started in 1998, and we did in 2003, 8, 13, 18, and 2023 we are planning. So we have 5 rounds of Kerala migration survey, which also has some questions on aging. We have both cross-sectional and panel data on migration. We started in 1998. After starting this, lot of demand for looking at aging in Kerala. Kerala wanted to prepare what we call them Kerala aging policy. And they requested us, can we think of a survey? That brought us, based on the Kerala migration survey of 2013, which is a representative survey for Kerala, we started our first Kerala aging survey in 2004. Probably in India, I don't think we have any states had any aging survey panel-wise. I'm not sure about even countries in South Asia, if they had any survey on aging. We started our survey in 2004, And then we repeated every 3 years. We started in 2004 with 5,000 elderly. 5,000 elderly based on our Kerala Aging Survey. And some of the reports are available with us. And we have some of the publication will be shared by my research staff for you through the chat box. You can look at it. We have published a few things. We have also data is available to the public domain. And both Rahul and Saito have extensively looked at the data. They are writing some papers, and other people, both within India and outside India, also using this data to write some of their research papers. So we started in 2004 with the 5,000 people, and we completed 6th waves. We started in 2004, we repeated in 2007, 2010, 2013, 2016, and 19. Now the 7th wave started last week in 2022. So we have close to 7 waves of aging survey for the last 18 years. So every 3 years we have the data. We started with 5,000. Right now, the first panel what we have 1,000 people. We lost 2,000 people, 2,000 plus people through death. And we lost many people who are not interested to be part of the survey, or they have been taken by their children to some places we are not able to trace them. Still, we have 1,000 people with us. We started in 2004. All of them now close to 80 plus. And we also have data on people who died. We have data on cause of death, medical attention at death, which is very, very important because we are giving so much talk about medical attention at birth. We have data on medical attention at death, cause of death. As Rahul rightly said, we also have a date of death and other related issues at the time of what we call them at the time of death. So people can use the data. We have 2,000 people who died over the period of 15 years in our panel. People can look at it and you can use the data for any research to estimate life expectancy and other related issues. And the second thing, at the wave in 2004, we have collected several dimensions of aging. We have collected several dimensions, and all can be looked at it with basic data any other surveys collect. For example, we got general, social, economic, and other related data, but we have special data on labor force participation. We have data on property and land ownership. Many surveys don't ask because elderly, most of them probably holding some land, some ownership, and their savings, their assets, their investment, their medical records. And we also asked about their children and grandchildren and their own siblings. We want to know these elderly people, their own siblings. How many of them were born with them and how many of them already died. So we got a lot of family history in our survey. We can even estimate historical fertility through our aging surveys. And we also had falls among elderly. I think this is something very, very important because according to our survey, 1/5 of the elderly had fall at any time in their life. And I can tell you, when we look at the data between 2004 and 2014, people had experienced fall in 2004. We lost half of them through death in the next 15 years. So falls and related health issues, bedridden, broken hips. I think these are all very, very important topics which is emerging because falls is going to be one of the things which is happening among the elderly. And we have written some papers on that. It is available in our website. We are also giving you the links of some of the publication done by us and others put in our website. And this survey, as I said earlier, we were running for almost 6th wave. And as you know that, this wave is slowly going to end from us because we started in 2004 and then we are having now wave 7 in 2022. And maybe we will continue this wave up to 2025 and probably 28 because we are not adding any new people in this survey. We have a lot of basic data and you can follow them up with health issues, You can follow up them with several things in the data. And the data is available in the public domain. I will give my email to you after my presentation. You can write to us, we can share, you can compare, you can do socio-cultural analysis, you can do panel analysis, and if you are familiar. And after the Kerala Aging Survey, we are also helped to provide our questionnaire for the longitudinal aging survey in India. Now we have a LASI which exists in this country, but we were the one started the aging survey in India with a particular state, which was the aging society, we call them. The second point I would like to make for the next few minutes is that we also know that the first aging survey probably will end in another 6 years. By knowing that, we started what we call them the second Kerala Aging Survey. Second Kerala Aging Survey. Now, second Kerala Aging Survey started in 2013. We wanted to have the same time, 2013. So what we started off 2013, we are now continuing with our rounds. And 2013, we started with close to 8,000 people. This data is also available in the public domain. And we replicated the survey in 2016, 2019, and our round is going to start anytime this year. We will complete the fourth wave in 2022. So we have two panels which we can use it. And this second panel data are the second Kerala Aging Survey, which is available in the public domain, which was more tuned to the international level, supported by Saito and other people. We have the similar questions what we had in 2004, but we added anthropometric measurements such as waist and hip ratio, height and weight, hand grip, and religiosity. Because people, when they get old in India, probably they will be spending more time in temples and churches, how it helps them to the psychological well-being. Because Kerala is reported as one of the states with highest suicides in India, highest suicides. We would like to know, is the elderly in Kerala, what is the suicide rate? Or they are getting their mental health basically through their religiosity. We have done this particular analysis, and this survey continues. This survey also available in the public domain. Before I conclude, I would like to make 2-3 important findings. One is that our survey has been extensively used for preparing Kerala aging policy by the government of Kerala, because the second Kerala Aging Survey, which was done in 2013, we were following it up now, was funded fully by the government of Kerala. So the government of Kerala using this to prepare the Kerala aging policy. The second one, there is a palliative care policy in Kerala. This is also based on our report on the importance of caregiving for the older people. We also did what is called the institutional survey. Kerala had close to 300 old age homes. We did our first survey in 2004, visiting all old age homes and all inmates. And we are going to replicate the survey in 2022 by visiting all old age homes and all inmates in the old age home. Currently, we have close to 500 old age homes in Kerala. This survey is going to start now. The second important point which I told you is that out of the people who had falls in 2004, half of them have already died. I think this is something we should look at it. Can we think of some type of precautionary measure so that the elderly can avoid falls? Can we think of some type of measures to provide them some type of help so that they manage without fall for a long time? The second thing, we also had subjective well-being and also general health inquiry, which indicates the subjective well-being is very, very low in Kerala. I think this brings us an important debate. Is Kerala people are living longer? Are they living with healthy conditions? Because many people in Kerala believe they are living longer, but they are living unhealthy aging. They are not really living with healthy aging, because our survey indicate people with multiple disease, close to 3 diseases, close to 20 to 30%, with disability, all those issues, I think we should, our survey should lead for quality of aging and also giving life to the elderly at their sunset here. Thank you very much. I'm going to stop here. Thank you very much.
Thank you, thank you, thank you very much. And I think here we have a very critical question asked on whether we are living healthy or longer and healthy, and whether we are just living longer, but with very poor health. And again, you can see that actually this study also has very profound impacts on not only academics but also on policies. So we are looking forward to receive the links, and also I saw that there's some sharings on the publications already in the chat room that is all accessible.